The USET Tribal Epidemiology Center is proud to present What is a TEC? What is a TEC? TEC stands for Tribal Epidemiology Center. There are 12 TECs located throughout the United States that are operated by tribal organizations or tribal health boards who provide many public health services for their communities. TECs started in 1996 when there was a growing concern for inadequate public health surveillance and data for Native Americans. The USET TEC was established in 2000 to monitor and report on the health status of 36 tribal nations, from the northeastern woodlands to the Everglades and across the Gulf of Mexico. The USET TEC is staffed with epidemiologists and public health professionals working to promote wellness and reduce the burden of disease. TECs are designated public health authorities. Public health authority refers to an agency's legal ability to further public health by using tools such as community engagement, data collection, scientific research, laws and regulations, enforcement, and the many methods of sharing information and guidance with those who need it most. Public health authorities are commonly governmental public health departments. TECs are public health authorities that support the inherent sovereignty of tribal nations. Thus, TECs are not government bodies and cannot enforce laws or regulations. What does a TEC do? Tribal epidemiology centers support tribal communities in improving the health of tribal citizens through 7 core public health functions by collecting data and monitoring progress made toward meeting each of the health status objectives of the tribal communities. For example, our USET epidemiology team collaborates with the USET Diabetes Program to provide a diabetes report to our member tribal nations. The report includes metrics and success stories specific to each tribal nation to monitor their progress to meet their chosen goals. Evaluating existing delivery systems, data systems, and other systems that impact the improvement of tribal citizens' health. One example of this is the USET Epidemiology team, in collaboration with the dental program and member tribal nations, analyzes dental screening forms to evaluate the dental service delivery system and to identify and improve children's dental health. Assists tribal communities in identifying the highest priority health status objectives and the services needed to achieve those objectives based on epidemiological data. For example, the epidemiologists at USET partner with member tribal nations to conduct community health assessments. These assessments allow for data-driven decisions to determine the highest priority health objective for each specific tribal nation. The USET TEC and the tribal nation collaborate to determine what programs or strategies may be best to ensure the needs of the community are met. Make recommendations for the targeting of services needed by the population served. For example, the USET Epidemiology team publishes email alerts on important, time-sensitive, health-related issues relevant to our region. Past topics have included updates on infectious disease outbreaks, treatments, and vaccinations, such as COVID-19, RSV, influenza, malaria, mpox, environmental health risk, such as wildfire smoke, and general awareness for seasonal health topics, such as tick and mosquito prevention. These alerts are important to make recommendations to our member tribal nations to ensure the health of our communities. Make recommendations to improve healthcare delivery systems for tribal communities. For example, the epidemiologists at USET collaborate with member tribal nations when requested for electronic health record training and customization to ensure better flow in healthcare delivery and help the clinics meet all the needs of their patients. Provide requested technical assistance in the development of local health service priorities and incidence and prevalence rates of disease and other illnesses in the community. The epidemiologists at USET partner with member tribal nations upon request to assist with specific priority areas within the community. One example of this is the Infectious Disease Universal Screening Program, which assists in determining potential barriers to patients seeking treatment or testing and identifying obstacles facing health clinic staff. The USET TEC provides support with survey design, data analysis, and interpreting results with the goal of decreasing disease incidence and prevalence of HIV, hepatitis C, and sexually transmitted infections and diseases. Provide disease surveillance and assist tribal communities to promote public health. For example, the USAT Epidemiology team offers seasonal respiratory illness reports. These surveillance reports monitor metrics related to vaccination, hospitalization, and incidents specific to the USAT region and our member tribal nations. These reports can be used to promote public health efforts, such as encouraging vaccination or ensuring prevention measures are in place when necessary. What is epidemiology? Well, it's not exactly like what you see in the movies. The word epidemiology is formed by joining three root words. Epi, meaning broad or overarching, dem, meaning people or population, and ology, or to study. Putting the roots together, epidemiology is the study of what is upon the people. In other words, epidemiology is the study and analysis of the patterns, causes, and effects of health and disease conditions in defined populations. It is the cornerstone of public health and shapes policy decisions and evidence-based practice by identifying risk factors for disease and targets for preventative health care. At the USAT TEC, we understand that accurate data are vital to tribal sovereignty, self-determination, and understanding the health of tribal communities. Indian country public health has long been neglected due to the failure of the United States to uphold the trust and treaty responsibilities and obligations to tribal nations. So what exactly does the USAT TEC do? We address all the 7 core functions of TEC as mentioned earlier, as well as provide epidemiological support and expertise to our programmatic competencies, prioritize relationship building and data sovereignty advocacy to federal and state partners within our region, contribute our expertise to the USAT Sovereignty Protection Fund to enhance their health advocacy work, publish alerts on important time-sensitive health-related issues relevant to our region, spread awareness on a variety of health-related topics reflective of our region via social media posts, educational materials, and webinars. And finally, we respond to member tribal nation requests for technical assistance, subject matter expertise, data analysis, survey design, and much more. To learn more about the USAT TEC, please visit our website or email us at usatepi@usatinc.org.